Hello, everyone. Thank you so much for joining us today. My name is Kissa Thompson, the engagement specialist here at OpenStax, located in Houston, Texas. And we're so excited to have you join us today. While we wait 10 seconds or so to get the webinar started, please let us know where you're joining us from. Let me give a few shout outs here. All right, we have California here. Hello. We have who else? All right. Janesville. Okay. Hello. Hello, everyone. And thank you for joining us. All right. We're going to wait 10 more seconds, get this crowd warmed up a bit. We'll get started. Okay. We have New York. Hello, New York. Texas. Hello, Texas. Thank you so much. Continue to let us know where you're joining us from. 5 more seconds, and then we'll get started. Ohio, hello. All right, so let's just jump right in. So most of you probably know what OpenStax is, but if you're new to OpenStax, there are a few key things you'll want to know. First, OpenStax is a nonprofit educational initiative based out of Rice University, located in Houston, Texas. We are the world's largest publisher of open educational resources. As a mission oriented organization, we are committed to expanding access to relevant and engaging teaching and learning materials so that all students can have an amazing educational experience they deserve. OpenStax has had a large impact on students and instructors across the globe. Since publishing our first text in 2012, we have saved 43.3 million students over 3.4 billion in textbook costs. Over 2,200 colleges in 169 countries and 72% of U.S. higher education institutions have reported using an OpenStax textbooks. These accomplishments would not have been possible without the support of OpenStax technology partners like Science Interactive and instructors like you. All of our books are designed to meet the general scope and sequence requirement of their respective courses and are written and reviewed by experienced faculty and subject matter experts. Each of our books also goes through an extensive editorial process to ensure that the content is up to date, clear to understand, and inclusive and representative of diverse audiences. Our textbooks look like a lot of the other textbooks that are out there. However, unlike textbooks that aren't OER, instructors can modify, remix, and rearrange the content in any way necessary to meet the needs of their students. Here at OpenStax, we offer much more than just textbooks. Each of our books also comes with its own unique suite of free instructors and student resources. These can include test banks, lecture slides, solution guides, LMS integration, and customizable doc files. Accessibility is a top priority. To make our books as widely available as possible, our textbooks are freely available 24/7, 365 days a year on our website in interactive web view format. You can also download free PDF copies of our textbooks on our website or purchase low-cost print copies. These options are particularly helpful for students who lack reliable internet access. Additionally, with the free instructors account, you can unlock unlimited access to our free instructors and student resources. All instructors account requests are quickly verified by our customer support team, ensuring only instructors are using our resources like test banks. As our library of textbook continue to grow, we're excited to share numerous titles that we have recently published. We now have a full 8-title nursing series and 5-title computer science collection available, as well as a lifespan development and the new 4th edition of American Government. If you would like additional information about these or any OpenStax resources, our customer support team is standing by to answer any question at info@openstax.org. Here at OpenStax, we know that technology is essential for teaching, especially in today's hybrid learning environment, and that finding the right technology for your course can be challenging. We help streamline this process through partnering with 35 education technology organizations that offer products aligned with our content. In exchange for using our content in their products, our technology partners provide us with mission support fees that help us to maintain and reinvest in our products while maintaining affordability for their products. Ultimately, OpenStax technology partners enrich OpenStax material with low-cost, high-value resources to support instructors and students. Now we'll pass it over to Science Interactive. Thank you so much for joining us today and enjoy the webinar.
Thank you, Kessa, for the introduction, and thank you, audience, for joining us today while we discuss how to bridge the gap between education and practice for future-ready nurses. Now, before we begin, I'd like to introduce myself and my co-presenter for today's session. I'm Duane Cagle. I'm the senior scientist at Science Interactive. My background and degrees are in biology and vertebrate zoology. And for the past 14 years that I've been with Science Interactive, I've developed experiments and the associated curriculum in a variety of life science disciplines, such as biology, microbiology, anatomy and physiology, genetics, and environmental science. My co-presenter today is Dr. Susan Rouse. Susan has over 35 years of experience in nursing and higher education at both the undergraduate and graduate levels. Susan has expertise in academic leadership, curriculum and faculty development, program evaluation, nursing accreditation, and authoring for nursing textbooks. Additionally, Susan is an experienced bedside nurse in both critical care for neonates and adults. Susan, you just want to take a minute to say hello?
Yes, you guys, thank you so much for coming today and taking some time out of your very busy schedules to listen to us.
Great. So before we officially get started, I just want to remind everyone why we're here today and what our purpose is. At Science Interactive, we're here to help nursing students get in, get ready from prerequisites to clinical confidence. But before our presentation gets underway, we want to begin with a really quick poll question. And that question is, where are you currently offering nursing fundamentals courses? And select all that apply, whether it's online, hybrid, you're not currently offering a nursing fundamentals course, or you're actively developing one. And we'll take about 10 seconds for you to submit your response. All right. So it looks like about half of you are offering the course online, and the remaining number is in some type of hybrid format. So let's start by discussing what are the challenges in offering nursing courses to your students. Well, the number one challenge currently is there's a critical shortage of nurses and therefore an increased demand in these types of courses. Indeed, there's an anticipated shortage of over 100,000 nurses, and this is only growing. And we need therefore more trained nurses now more than ever. You know, approximately 82% of all STEM educator leaders feel increased pressure to expand their allied health programs. And the top three barriers to this pressure and this challenge are limited funding, limited space, and flexible lab options without compromising rigor. So how does this flexibility, pose challenges for the educators? Well, the number one challenge for flexible scheduling and space is meeting students where they are. As you're already aware, most allied health students are what we consider in academia to be non-traditional students. They're very busy individuals. They probably already have jobs and families. So assisting them in balancing all of this with their education is paramount. Other challenges for these students include financial constraints, just feeling confident that they're prepared with the appropriate science background before they move into their professional programs, and also just scheduling and their lack of finding flexible programs out there that are available for them to complete their education. And here you see some quotes from students regarding commuting, scheduling, and how they work full time and try to fit everything else in. A challenge for educators is ensuring quality and rigor in the courses that they offer. Typically, when we look at alternative venues to the traditional face-to-face instruction, a lot of educators, when it comes to laboratory experiences, have relied on virtual simulations. And what they've learned over time is these aren't always sufficient. But if we can combine those virtual simulations with more traditional hands-on learning experiences from the laboratory setting, students receive the best of both worlds. And here you see in this chart that indeed in the green versus the blue, that when virtual and hands-on activities are combined within a course, that students do perform better. So what do we do at Science Interactive? Well, we offer just that. We offer a mix of virtual and hands-on labs. And when we poll students in our annual lab report survey, what we find always is that indeed that mix of both virtual and hands-on experiences are preferred by the students themselves. Now, each of these approaches has its strengths and weaknesses. The strengths, as we are all familiar with hands-on experiences, they provide students with authentic experiences that mirror what they do on campus. It equips students for real-world professions, and it ensures rigor and also to support the transferability of their credits and requirements. With the benefits of virtual simulations is that students are able to observe typically unobservable phenomena. It's also a low stakes environment for the student, meaning that it's very easy for them to practice an activity multiple times without either using up expendable materials or facing any consequences when they mess up. And also, not all students learn in the same way. So for some students, that virtual experience really appeals and assists them in learning content that might otherwise be more challenging if they could only experience it hands-on. Our approach is that we believe science should be interactive for all students, no matter where they are. And we do that by supporting different modalities of laboratory courses. So we can deliver curriculum and hands-on lab activities, including virtual simulations too, to fully online courses. We can also support the hybrid learning system. So we can fulfill the lab needs of your on-campus course for your remote students. And then lastly, even if you have a fully on-campus program, your students can use simulations before they get to lab in the form of pre-lab activities, so they are better prepared and can maximize the efficiency of the time they spend on campus. So let's take just a moment for our second poll question today. And that is, which of the following is your biggest challenge with your nursing courses? So only select one answer this time. Is it ensuring quality and rigor online? Is it ensuring student preparedness, student engagement, or is it dealing with the challenge of limited lab space on campus? So get about 10 seconds. If you could submit your replies during that time, we'll take a look at the results. All right, let's see the answers. So a pretty even split between student preparedness and student engagement is being the biggest challenges. But you know, all four answers received a fair amount of response. And indeed, you know, they are universal challenges of programs out there. So just a quick overview of our products and services. You know, we do more than just support nursing courses and allied health programs. We actually have an experiment and curriculum library of over 480 titles across 15 disciplines. So in the traditional science, gen ed courses of biology and chemistry and physics, to the more upper division 4-year type courses of anatomy, physiology, and microbiology, and genetics, general organic and biochemistry, to you know, maybe some more alternative type courses such as earth science, environmental science, forensics, and pharmacy technology. But what we want to spend the bulk of our time on today, giving you an overview of, is our nursing fundamentals course. And I'm thrilled to turn that part of our presentation over to the author of that curriculum, Dr. Susan Rouse.
Thank you, Dr. Cagle. I'm, again, so excited to meet with you all today in this webinar. I really am very passionate about this work that I did here for Science Interactive. It's a very fun, engaging product that I think many students would benefit from. And I also had the opportunity to author a couple chapters in the OpenStax textbook for nursing fundamentals. So when I was authoring the content for this, I was really able to align that, which is really important, because a lot of times we all know nursing students want to see the black and white. So they want to see it in the words, and then they want to see it in the you know, the rest of the content that they're learning from, the interactive piece of it. So that's what we really tried to do, was bridge that gap, help try to expand the access by removing barriers to nursing education, especially for working students. We all know that our students are working. They work a lot in order to support all those other pieces of their lives. And so we know that they don't have the time to just spend in a lab on campus, or if they're in clinical, they're maybe learning some of the pieces, but with Science Interactive product, they're able to get all of the understanding for the content. We know that this helps with increased enrollments and having that unique online clinical offering. Definitely maintaining the high academic standards. So we'll have a slide later on that'll talk about accreditation requirements, but also know that many of the fundamentals and just Science Interactive content in general meets QM, which is Quality Matters, which is also a very rigorous content area, or a rigorous part that we use for online learning, that there are certain aspects that need to be met in order to get that approval from Quality Matters. And so that also tells us that this is a very rigorous sort of content. And then we want to make sure that there's workforce readiness. We know that nursing students need practice with those clinical skills. No one can walk into a room the first time and start an IV. And so the more that they're able to pull out their kit, work on it through Science Interactive, practice, the better they're going to feel when they actually get into that clinical setting and able to do the work there. Next slide, please. So we build, that's called building that clinical confidence. So we have this lab grade or health grade kit that has the practice arms, it has the blood pressure cuffs, it has the stethoscope, it has all the things that a nursing student can use, not only with the kit, but in their real life when they actually go into the clinical setting. We have these virtual labs that are hands-on practice with unlimited repetition and skill reinforcement. And so we know students nowadays in this world learn really well, for the most part, virtually. They're used to being online. They've been on a computer for years. they've started in grade school. And so they have that ability to work and do these virtual labs. But we know that that's not maybe always the best learning. And so then we're able to give them the hands-on piece of that too. We talked about the subject matter experts aligned with accreditation. And then we also have this integration with the OpenStax textbook, which is great for nursing students, because we say nursing students work a lot. Back when I was teaching, sometimes nursing students would have to spend $400 on a semester worth of books. That's no longer. We're able to get those access with OpenStax, have that alignment, and get all that stuff for free, which is great. Next slide, please. So right now we're going to unbox a kit. I'll tell you that there is some underlying music that if you would like to listen to, it is available by pressing the speaker in the lower left side of the screen, and it's just background music. But I am going to just talk through this unboxing. And as you can see, this is exactly what we're talking about, that medical grade content, health grade products. This is the sample kit. This is for the standard nursing fundamentals kit. It's very neatly packaged. It's easy for the student to identify. I mean, we know a nursing student who's starting in fundamentals, they don't know what half this stuff is. And so they have labels and names and things that they can understand that a little bit better. And, of course, they're going to get excited. And so, there's never been a nursing student who went into fundamentals who wasn't excited to look at their first stethoscope or put it around their neck, because it's sort of that thing that they've been dreaming about this whole time. And now it's actually a reality. And that's really important that they're able to do that with this. And you can see at the very end of this box, we've got the injection trainers, we've got the pulse oximeters, we have the blood pressure cuff, we've got the blood glucose monitor, we have the thermometer, and the last thing here is the stethoscope. So again, high quality, health grade products that the students are going to be able to use for a lifetime if they keep them in a good place. All right, next slide, please. All right, so then we get to what is in the fundamentals labs. And so just by seeing the unboxing, these are some of the things that we are going to be using. And so, of course, we're going to be doing administration of injections and oral medication and topical medication and assessing pain. But we're also going to do some virtual labs like the automated medication dispensing system. So, of course, we're not going to send a Pyxis to your house, but the student's house. But what we are going to do is give them a virtual lab that then they're able to play around and figure out the system so that they feel more comfortable when they're in the clinical setting. Blood glucose testing, head to toe assessments, do they need a hammer? Do they need the scissors? What else are they going to need to do that assessment? They're going to learn about nursing process. They're going to learn medical terminology, which we know is a very important part of nursing fundamentals. They're going to learn how to perform blood draws. Students always like the guts, right? They like the stuff that they can be manipulating with. And so doing the blood draws, administering the injections, starting the IVs, those are the things that they're going to have the most fun with, if they want to say it that way. And then we go through principles of medical administration. We're going to have the students collect a UA, a urine analysis. We're going to have them do all the vital signs, and then wound care and dressing changes. Next slide, please. And so I alluded to this earlier. This is our alignment with CCNE and ACEN standards. Everyone who has a program, online or otherwise, has to, hybrid, whatever it may be, has to be providing the CCNE or ACEN standards in order to, apply for the nursing license or whatever it may be. And so if we look at just some of the competencies in the AACN essentials, we could say that one of the competencies is assessment. And so we have a whole science interactive lab that's about health history intake and documentation exercises. Then we're able to maybe look at the findings. And so in these labs, we also talk to the students, or they're designed so that the students can look at both the normal findings and the abnormal findings, because they, first of all, can't draw that line in the very beginning. And second of all, it's really important for them to understand what the abnormal is, so then they can start just looking for that the next time that they're looking at the patient. So we're going to give them all that stuff and then give them some escalation criteria. So you took that patient's blood pressure and it was 120/80. All right, is that normal or abnormal? What can we do from there? All right, now you took another patient's blood pressure and it was 180/120. Now what should we do about that? And so then that gives that student that ability to learn that process. And we all know that the more you see something and process it in your brain, the better it is for them to understand. And the next time that they're in the hospital or at the clinical setting or on campus and they see that blood pressure of 180/120, they now have the ability to make some of those decisions about what should be done next with that patient. So that is how, and this is really important for all of us who teach in a program, to have those standards met. All right, go ahead. Thank you. Next slide. So this is kind of what, this is not kind of, this is what the slide looks like from Science Interactive once you have the product. And so it gives you from the very beginning on the first page, the estimated completion times, and then the learning objectives, so that that patient or that student knows from the outcome what it is that they're going to be doing and how they're going to be doing it, and what it is that they need to be able to walk away with after they've completed it. All right, next slide. And there is, in this next slide, the next pages, there is then content presented with pictures and words, because as Dr. Cagle alluded to earlier, we know our students learn both visual, auditory. Some learn by reading and writing, and some learn by doing or kinesthetic. So we tried to cover all of that. You know, we looked at that from every angle and tried to make sure that those students were getting all of that, so that they could then say, all right, well, maybe I'm not doing well with reading, or reading's not my thing, but look, I can look at pictures and I can also practice with the stuff and learn it from here. And so then the other thing about that is then we're going to start testing that student's knowledge. And so we have some very rudimentary questions just to sort of look at the learning from the get-go, but then we do sort of progress on to more standardized questions that the students would see when they are in NCLEX, right? So we would have some multiples, or some questions that require some thought, and then we would start getting that student sort of build that knowledge in order to be able to perform and be confident in the clinical setting. Next slide. And then we have the step-by-step instruction. So what we were able to do was go through each individual step of a process and write it out word by word. And you can see here on this slide, it says pivot the hinge needle cover towards the tube holder and remove the needle cover, so that the student knows exactly how to do that part. And then there's also a picture of it. And then sometimes we provided a video too, and other links and ways for that student to learn and understand that, assess their understanding. And then the last piece of that is, we know students learn if they log, right? So then they see it, read it, write it. Then they go back and they say, okay, I log this content that I just did by saying, this is the blood pressure that I got, or this is how I did this oral injection, or whatever, or oral administered this oral medication. So each way we're looking at that proper clinical technique and then having them log for that instructor to see how that was done. All right, next slide. So, and you can just see here, this is just sort of the level, or the high level of content for the simulation or the virtual clinical. And so this is the ADS. And so they're going to scan that patient's armband. They're going to review the patient's medication order. They're going to retrieve the medications and then record the administration of the drug to the patient. So again, you're going to be, as the instructor, you're going to be able to look at those logs, see how this patient or the student performed from the backside, make sure that they've got their content understood. Okay, I think the next slide. All right, back to you.
Great. Well, thank you so much, Susan, for giving us that overview of both our experimental materials and the associated curriculum for our nursing fundamentals discipline. I hope you in the audience can see after that wonderful presentation by Susan that we are here to help nursing students get ready from both prerequisites to clinical confidence. We've covered a lot of information today, and I'm guessing you probably have some questions. So at this time, I encourage all the members of our audience to enter your questions into the chat, and both Susan and myself will take as much time as necessary to answer those questions or address any concerns you may have about anything that you saw today. And looks like we do have some questions coming in. So the very first question I have is, does Science Interactive curriculum integrate with learning management systems? Absolutely. So what you saw in a couple of the screenshots that Susan covered during her portion of today's presentation, we house all of our curriculum in an interactive platform, and that platform can easily be integrated into your learning management system. So it's a seamless experience for your students, single sign-on capabilities, grade porting, all of those effects are present and available during the integration process. Let's see, oh, so many questions. Let's pick another one here. How much training do my faculty need to implement your curriculum and what we've seen today, the kits? You know, I think Susan and I can probably both take this question. As far as training for the curriculum itself and the LMS integration, we do have specialists on our staff that can work with any given institution's IT department to ensure that integration is as smooth as absolutely possible. And it can also troubleshoot should you suspect you're having any issues once things are integrated. As far as the training and the materials and the curriculum specific, I'm going to pose that question to Susan since she developed the curriculum, and you know, she can share her thoughts on that.
Yeah, I don't think this is a very user unfriendly content area or content. You know, it's very straightforward and I think sort of logical in its development. But of course, you would want to spend a couple hours probably with your faculty sort of reviewing and making sure everybody felt comfortable with it. But, you know, so much of what the kits offer are things that students are already buying and purchasing and having in the lab currently. And this is just going to give them a little spin because this is going to give them that stuff, plus also then all the content that goes along with it.
Wonderful. Thanks, Susan. Here's an interesting question and a common one for all the disciplines that we support. One of the attendees has asked about safety and can we address how we ensure student safety while doing the experiments at their homes. So we make sure when we develop the procedures, and Susan showed you a little snippet of part of our lab manual from the blood draw lab that it showed the butterfly needle and the vacutainer that was attached to it and all. So we make sure we provide the student with very detailed instructions and also photographic representations of those instructions throughout. We are confident from a broad standpoint that if students follow our instructions as written, that they will not incur any type of injury to themselves or anyone nearby. And indeed, we are the liable agent should students incur an injury. And we're very happy to state that in our multiple decades of supporting online science labs, that we've had 0 insurance claims over the years. So we're very dedicated to that. And also, I'll let Susan expound a little bit on this, but we've also made sure that any invasive type procedures, the students are using models for that, and they're not, for example, practicing blood draws on a fellow student or anything like that. Is that correct, Susan?
Right. Yes, absolutely. So they're going to be using a model and not a person to do it. And we've, done all the safety standards that are acceptable in nursing, with needle covers and all those things that are we see in the clinical setting. But we also encourage the students, I can say, for example, that maybe the student has a child in the home, there is going to be medical grade equipment then in the household. So, there are going to be some sort of conversations that need to be had with the students that say, this is sort of something that you want to keep out of the reach of children, maybe, that you don't want your child to get into or play with on a regular basis. And that's, I'd like to say, common sense. But yes, that is still a concern.
Great. It looks like we're running a little short on time, so we'll try to get 1 or 2 more questions here. Here's another pretty frequently asked question that came through again today. Says, do the students pay for the online lab portion and kits separately? And what kind of costs are associated for nursing students? The answer to this question is really determined by how the school wants to handle this. I know at some institutions, a student pays a flat rate per semester, and their textbooks and lab materials and everything are included in that. The more traditional, however, model is that the student pays their tuition and maybe some minimal course fees, but then they are liable for textbooks or lab materials or any ancillary type items required by their course. So it really is determined by how your school is set up to handle that. We can collect student payment, or we can have all of that run through your institution. And either way, the follow-up question to this is always, well, how do students get the kits once that has been handled? And again, we can ship kits directly to students, and we can ship them to the school and have students pick them up through bookstores in a more traditional format. But again, it's flexible, and it's totally up to what works best at your particular institution. Let me see if we can squeeze in 1 more question here very, very quickly. Says, can you talk more about the Quality Matters certifications? Well, I can address on my end that our nursing fundamentals discipline has recently been certified and approved by Quality Matters. So we're very happy to share that with you, as have all of our other disciplines. We're firm believers in that our curriculum and lab materials are very appropriate and equivalent to the experiences students have on campus. So therefore, their credits can transfer and be applied in all situations that need be. Susan, do you have anything you want to add about Quality Matters?
Right.
Or experience in that?
So Quality Matters, we know, is that system designed to evaluate the components of online learning and maintaining a standard. And so when you see anything that is Quality Matters approved, certified, then you know that there is that standard. And accreditors look for that. They look for that standard being maintained. And if you say that it's QM approved, QM certified, then they will know what that means. We're now able to compare apples to apples instead of apples to oranges.
Great, thanks. Well, we want to hear from you, the audience. So if you would like to learn more about what you've seen today, and indeed, if you would like the opportunity to have the materials you saw in that video in hand, so you can evaluate them personally, we would like to offer you that. So we have a limited number of sample kits available. You can scan the QR code on your screen right now to request one of those sample evaluation kits. And again, we're here to serve you, whether it's to deliver truly online materials for your remote students, to support your hybrid learning programs, or even to enhance and enrich your on-campus labs. But again, we want to stay in touch and we want to hear from you. We certainly thank you for your participation today. And in closing, once you've had a chance to scan this code, we have one final poll question for you. We'll just leave that poll question up here momentarily. You can answer it on your way out from today's presentation. From both me and Susan, thank you again so much for your attendance, and thank you, Kissa, for hosting us today. And we look forward to speaking with you in the future. So here's that final presentation question, and thanks again for your participation.
Yeah,
thank you very much.
Yeah, so I would like to follow that with a thank you, everyone, for joining us today. Thank you, Science Interactive, for the amazing webinar, and for everyone who joined us from all over. We appreciate you. As they mentioned, please take a moment, and if you are interested in the Nursing Fundamental Lab demo, please click a yes if you are. If you would like to get in contact with Science Interactive, please check your chat area. Susan has put some information, some links, so you can link to contact them directly. And in the meantime, you know, enjoy the rest of your day and check out our website for other webinars. And until then, bye-bye for now. Thank you.